finish this debate. Did you see Stephen's face when I punished him on the healthcare issue?
Steve's such an idiot. How you gonna make health insurance mandatory?
We should stop the taxes and make them all pay themselves.
For me for Congress, huh? Cheers to another election won by me.
Alright.
Now check this out. Once I make the vote to totally eliminate all subsidies to health care and make businesses pick up the tab, they're gonna regret ever putting me in office.
Wow, Terry. You have way too much to drink.
Well, what's going to happen with my kids? How are they going to be insured?
Yeah, I have a grandmother who doesn't work. Where he going with this?
Well, I gotta save America.
Pick a different way. Mr. Kimball.
Who's there?
Mr. Kimball.
Who's there?
Mr. Kimball. It is me, the ghost. It is me, the ghost that has the first.
What do you want from me? What do you want from me?
I will destroy the country.
Go away. Go away.
You have done.
Oh my God, that's Tina. What is she doing?
Look, she's shooting up because she can't take the pain anymore. She can't have any children because she can't afford the medical bills. And look, the drugs that she chooses to use is the drugs that you introduced her to.
What about Barb? Is she okay?
Look,
What is she doing?
Barb just found out she has cancer, and she can't quit drinking. Because of her drinking, she has lost everything, and she doesn't have a healthcare plan at all.
Well, why didn't they tell me? Why didn't they tell me about this?
They're afraid of you, Mr. Kimball.
Go away. No more, please. No more, please. Go away. Please, leave me alone. Please, leave me alone. Please, leave me alone. Leave me alone.
Come with me, Mr. Kimball. Come with me, Mr. Kimball. To show you what you can do. Show you what you can do. Show you how to do.
Where is everybody?
Kill them all, Mr. Kimball. Shortly after you passed that healthcare law, the virus spread. No one can afford the care. Bye, Mr. Kimball.
Go away.
I had a dream last night that I was visited by two ghosts. They told me that health care should be free and that no man should have to pay for health care to live. Every doctor should become like the Messiah and heal for free. This will not only decrease the deficit, but it will heal us all. I want all Americans to believe in hope. I want all Americans to believe in change. God bless America.
Sitting here thinking about the things we didn't share, the memories we had, our dreams, but you didn't even care. You were the one that I dreamed about. Then you took my heart and you left me whole. I'm still wondering why you let me go. Why would you break my heart in two? I thought I will always be your number one boo. You said that
After years of trying to find a solution to America's healthcare struggle, Obamacare made it through the House. It was passed and is now considered a law, with some changes. Obama approached the podium May 2013 to explain his healthcare law.
The Affordable Care Act, Obamacare, has now been with us for 3 years. It's gone through Supreme Court tests. It's gone through efforts to repeal. A huge chunk of it's already been implemented. And for the 85 to 90% of Americans who already have health insurance, they're already experiencing most of the benefits of the Affordable Care Act, even if they don't know it. Yeah, their insurance is more secure. Insurance companies can't drop them for bad reasons. Their kids are able to stay on their health insurance until they're 26 years old. They're getting free preventive care. So there are a whole host of benefits that for the average American out there, for the 85 to 90% of Americans who already have health insurance, this thing's already happened. And their only impact is that their insurance is stronger, better, more secure than it was before. Full stop. That's it. They don't have to worry about anything else. The implementation issues come in for those who don't have health insurance, maybe because they have a pre-existing condition and the only way they can get health insurance is to go out on the individual market, and they're paying 50% or 100% more than those of us who are lucky enough to have group plans. People who are too poor to get health insurance and the employers don't offer them. Maybe they work for a small business and the small business can't afford right now to provide health insurance. So all the implementation issues that are coming up are implementation issues related to that small group of people, 10 to 15% of Americans. Now it's still 30 million Americans, but relatively narrow group who don't have health insurance right now or are on the individual market and are paying exorbitant amounts for coverage that isn't that great. And what we're doing is we're setting up a pool so that they can all pool together and get a better deal from insurance companies. And those who can't afford it, we're going to provide them with some subsidies. That's it. I mean, that's what's left to implement, because the other stuff's been implemented and it's working fine. The challenge is that, setting up a market-based system, basically an online marketplace where you can go on and sign up and figure out what kind of insurance you can afford and figuring out how to get the subsidies. That's still a big, complicated piece of business. And when you're doing it nationwide, relatively fast, and you've got half of Congress who is determined to try to block implementation and not adequately funding implementation, and then you've got a number of members of or governors, Republican governors, who know that it's bad politics for them to try to implement this effectively, and some even who have decided to implement, and then their Republican-controlled state legislatures say, don't implement and won't pass enabling legislation. When you have that kind of situation, that makes it harder.
After numerous speeches and explanations, many citizens are still skeptical about Obamacare. Some wonder, can the law be constitutional when the preamble gives us the right of life, liberty, and the pursuit of happiness? No one can say or predict what the outcome of this new law will bring, especially for those who have never had to buy health care coverage.
Oh, it's your thing. Ladies and gentlemen, welcome back to The Pulse. We had an excellent show. Talked about health care. We're live and loving and living life. Me and Linda went to a party last night. We just enjoyed ourselves. We danced. We're living it up. So health care is not a bad thing. This is not a socialist country. It's still capitalist. We're still alive and well. I've got some money in my pocket, Linda. I'll loan you some so we can pay the bills, right? How about you, Wayne?
I'm always taking it.
I know, I'll take you. Then Wayne gonna go to the doctor just to take a vacation. You know what I'm saying? Just to get treated by the nurses. Thank you so much for tuning into The Pulse with your host, Brian West. the lovely, elegant, and always solutional, just Linda Ray, and the Wayne, the music maker. We just had an excellent show. Have an excellent week, everybody, and stay healthy. Stay healthy. Work out, be strong, and try to get as fit as me, huh? Go to healthcare.org and .gov. Oh, that means government. I'm sorry. So go to healthcare.government. See my smiling face and sign up for the new healthcare law. We all can have a big healthcare party, huh? That's right. We'll pass out. I don't want to say that.
We'll pass out.
We'll pass out blue pills and Similac, huh? We'll be right back in the pulse next week. Thank you so much for tuning in with Brian West and Linda Ray and Wayne the Music Maker.